Hello everyone, Dr. Sutter Caton, physical therapist here with Vive Health. I'm looking forward to sharing all my knowledge with you and I hope you enjoy. I'm going to show you a really great way to stretch the quadriceps and stretch the hip flexors. It's going to help prevent those injuries related to patellofemoral pain or runner's knee, as well as some other issues like meniscus injuries, and generally just kind of help your flexibility because a lot of people have tight quadriceps and tight hip flexors. So what you're gonna do, you're gonna have your stretch strap. You can even use a towel for this. You're gonna loop it around your foot, lay down, and then I'm gonna pull my knee to my backside. So I'm gonna go until I feel that good stretch and hold it for a minute. Some things you wanna look out for while you're doing this are areas where your body may compensate. So a big one is you really may wanna arch your lower back to try to your body's thinking it's helping you by taking some of that stretch away, but it's defeating the purpose of the stretch. So I like the floor because you can kind of just go down on your forearm, relax into the stretch, take some deep breaths to help that muscle relax a little bit more. And similar to other stretches, what I like to do to get a little bit more out of it is to first pull myself deeper into the stretch. So right now I'm trying to pull my heel to my butt actively. So the same motion the strap is pulling me, I'm trying to actively do that with my hamstrings and my glutes. And then what you can do is hold the band tight, and I wanna try to push my foot back out. So now I'm resisting the stretch. I'm gonna hold for 10 seconds, and then I'm gonna pull myself into even more of a stretch. Simple way to stretch the outside or the lateral hip, as well as some of the muscles that tie into the IT band, which can be really tight on people who have patellofemoral pain or runner's knee, where a lot of times the tightness on the lateral aspect of the thigh here is sort of pulling the kneecap to the outside and causing some irritation down at that joint. So simple enough to do anywhere, even in your car, is you're gonna be sitting down, you're gonna bring that ankle up on top of the knee. Now, depending on how flexible you are, this may already be a stretch for you, so you may not need to go further. If you need a little bit more of a stretch, what I tell people do is not think of bringing their chest down, but I want you to imagine pulling your belly button to your thigh. So what that looks like, my chest is staying up, I'm going into that stretch, and you'll feel a little bit more of a targeted stretch for the outside of the hip. So you should be feeling that somewhere in the outside of the hip or the thigh, just depends on your individual tightness and where those areas are. So similar to other stretches, a nice technique I like to use is add some active contractions. And so what I'm first gonna do is pull myself deeper into that stretch. So it's difficult to do, you're not gonna actually be able to do the motion, but as long as you're contracting the muscles, that's the goal here. So what I'm gonna do is I'm trying to pull my ankle and lift it away from my thigh. It's gonna be very tough. You might even feel some cramping muscles, but I'm trying to pull myself deeper into that stretch, hold for 10 seconds, and then I'm gonna push my ankle down into my knee away from me. You can also think about pushing the knee towards the floor. So now you're gonna feel those areas that were stretched, you're gonna feel those contract a little bit. And it's gonna have you're gonna have an easier time relaxing those muscles. Once you've done both of those for 10 seconds, go back into that stretch, see if you can't sink a little deeper. So remember, think about bringing your belly button to your thigh, not your chest. So I lean forward, feeling that good stretch on the outside of the hip. Next, I'm gonna go over a basic glute bridge, an exercise you might have seen a number of times before, but I'm gonna cue it and pick some finer points that I like to coach on people, and so hopefully you get a little bit more out of the exercise. So as we do with any bridge, we're gonna come down flat on our back, have our knees bent, our feet flat on the ground. So what I tell people first is I wanna start in what we call a posterior pelvic tilt, so another one you might have heard before, but basically I tell people you wanna flatten your lower back and sort of tuck your hips underneath you. So I tell people, imagine you had a tail and you're tucking your tail between your legs. So this is my relaxed position. I'm gonna go into that tilt where I'm pushing my lower back flat into the table, or into the ground rather. And then once I'm in that position, I'm gonna hold it as I then think about driving my feet into the ground and lifting my hips up, really feeling my glutes and my hamstrings working here. I'm only going as high as I can while keeping that tilt. So a lot of people, I'll coach them, I'll cue them, put yourself in that tilt, flatten the lower back, and then they go up and they think, okay, the goal with this exercise must be to get my hips as high as they can. And to do that, you start to see something like this, where now the lower back is arched and now they complain of back pain. And even without pain, now you're taking the focus off of the glutes and you're putting it onto the erectors of the back. So once again, we start in that little bit of a tilt. We hold the tilt as we come up just high enough to where we feel like any higher, we're gonna lose that tilt. We can hold for a second or two, and then we come down. Easy way to progress that exercise is to come up on both feet, let down on one. What you wanna look for when you're doing it with one leg is you don't want the hips to shift one way or the other. So what you'll see a lot of times is the hips will kind of drop one way or the other, and that's just a sign you're either fatigued or you may not be ready for that progression of the exercise. So if that's the case, just go back to your basic bridge, try to get 15, 20, maybe even more of these. You really want to get an idea of what it feels like to activate these muscles, so you want to go a little higher repetitions. Find that tilt, bridge up just high enough where we're keeping that tilt, hold for a second or two, and we come back down. So this exercise is going to be targeting the glutes and the hamstrings. It's a good way to progress your standard glute bridge exercise, and it really biases the hamstrings a little bit more, which we've identified as a weakness when you look at people susceptible to ACL, meniscus, other knee injuries, patellofemoral pain, things like that. So you want a chair or some other surface that's about 2 feet or so up in the air. You're gonna lie on your back and place your heels on top of it. So compared to a regular glute bridge where you're having the feet flat, this one is just the heels resting on the surface. You're gonna scoot forward so you're about, say, close to a 90-degree bend at the hips, knees, and the feet. Then what you're gonna do is you're gonna kind of flatten or do a pelvic tilt, flatten my lower back just a little bit into the ground. And then I'm gonna really think about driving my heels down into the chair to lift me up, focusing on really squeezing those hamstrings and the glutes. So I'm here, gonna drive my heels in, I'm gonna lift up. The goal isn't to get as high as you can, it's to get as high as you can while you're still working the areas we wanna work. So it's pretty easy to cheat this movement and basically start to really lose that flattening the lower back, and now you're getting some arching the lower back and just some areas that we're not concerned about with this exercise. So I wanna tilt, push my lower back into the ground first, second, drive the heels into the chair to lift up. You're only gonna come up a few inches or so, but I guarantee you'll feel it working those hamstrings. Hold for a couple seconds and back down. A few ways to progress this exercise if you're finding it's pretty easy for you. First, you can go up with both feet on the chair, and then you can let one up and come down. So I call it 2 up, 1 down, up with both, lift one, come down slow. And then an even greater way to progress the exercise is to do it entirely on one leg. So I'll bring that one kind of off, or not necessarily touching the ground. You can also leave it floating in the air as long as it's not touching the chair or the ground. I'm gonna lift up, keeping that lower back in a little bit of a flattened position, and back down. And now you can really feel it working that hamstring.
I hope you found the video helpful, and thank you for watching.